Morning, Mrs. Jones. How are you doing?
I'm good. How are you?
I'm pretty good. Well, the doctor has ordered a dressing change for your central line here. We're also going to do a blood draw and a cap change after that.
Okay.
Okay, so I'm going to go ahead and just wash my hands before we get started. And then if I could just have you give me your name and date of birth, please.
My name is Claudette Jones, born 6/18 of 55.
Perfect. And Mrs. Jones, how long have you had this central line?
I've had it about 2 years.
Okay, so you're familiar with it?
Yes.
So we do a dressing change every 7 days, or when we do a blood draw, or if the dressing is dirty or soiled, we'll get that cleaned up for you.
Okay.
Okay, so I'm just gonna put on my equipment here and we'll get started.
Sounds good.
So Mrs. Jones, can you just tell me, when would we do a dressing change?
I think you said every 7 days, so once a week, or whenever we draw blood, or if it's dirty.
Okay. Good. And are you in any pain right now?
No, it hasn't hurt for a long time.
Okay, well that's good news.
Yeah, I'm happy about it.
So we are going to do a sterile procedure
Okay.
first. And so I just ask that you not touch anything or, I'm going to put a mask on you, which you already have. And I'm just going to have you look away from the site. And that's just so we don't contaminate the area. We want to keep it as clean and sterile as possible.
Okay.
Also, when we do the blood draw, after that I will do a cap change, and that's just so we don't get any clotting.
Okay.
And I will flush with heparin, and that'll help prevent with that clotting, okay?
That's good. We don't want any clots.
Right. So, can you just let me know, or what can you tell me about your cap change?
We're gonna do it because we're drawing blood, and then after we do that, there will be blood in the cap I have on now. So you're gonna change it out for me after the draw, and then put a new one on and flush it with heparin so I don't clot.
Perfect. You got this. I'm very familiar with these. Okay, so what I'm going to do first, Mrs. Jones, is just cleanse the area with some alcohol, and that just kind of loosens the dressing here.
Okay.
Okay, and then I'm going to just pull on the outer edges towards the insertion site, because I don't want to move the site line or anything to dislodge it. As I'm pulling this off, I'm also checking for any redness, discoloring, like odor, any foul odor, drainage, anything unusual that it wouldn't normally be there. But so far, you're looking good.
Good.
So I'm just going to inspect it. Okay, nothing unusual. We'll go ahead and toss that. We'll go ahead and do hand hygiene. Okay, so now I will be starting the sterile part of it. So I just ask that you just try to stay still and not touch anything so we don't contaminate anything, okay?
Okay.
I'm going to go ahead and put on my gloves first. Well, actually I can open this, make sure it's ready. set that there. Throw that, and then I'll get my sterile gloves on. Okay, I don't need that anymore, so I'll get rid of that. Keep my hands above right here. Don't need the extra gloves. Already got that. Already got a mask. We both got a mask on, so I don't need that. I'm going to extend my sterile field with this drape here. Okay, just set that there. Get my dressing ready here. Okay, Mrs. Jones, so here we go. We already got the sterile field going. Make sure we don't contaminate. I'm going to use my left hand and grab the line here. And use my other hand and grab the chlorhexidine. With this, I'm going to be scrubbing. So I just snap and then start scrubbing, scrub here. And make sure I get all the blood off. And make sure I get your line as well. Make sure I'm not touching your skin with my other hand here that I'm scrubbing with. Okay, so we got that. We don't need that anymore. I'll just throw that away. Okay, got your dressing here. Go ahead and put that on. And so it's covered. I'm just going to make sure we do have it all on correctly here. Okay. How does that feel, Mrs. Jones?
It feels good.
Good.
Felt nice to have it cleaned.
Yes. Okay. There is a sticky tab here, and this is just I'm going to put my initials, date, and time, and I'm going to make sure that I put it on so that everybody knows when the last time this dressing change was done,
Okay,
and who did it, and who it's for. Okay?
sounds good.
So that takes care of that. I'm going to go ahead and clean my area here. We're done with the sterile part of it. Do you have any questions?
Not at this time.
Okay, and how do you feel?
I feel good, thank you.
Alright, so I'm just going to clean my area here and grab my other equipment that I need
Okay,
and make sure I wash my hands. Very important. Keep everything clean. Okay, so what we're going to do first is flush your line with normal saline. I have 10 cc's here, and that's just to make sure your line is still patent. Do you know what that means?
doesn't that mean that it's still open, like there's no blockage in it?
Yep. I'm going to make sure that it's just working correctly, okay?
Sounds good.
Then I'm going to withdraw 5 cc's of your blood and discard that. So we're just going to get rid of that. We don't need that one. And then I'll draw another 5 that is going to be sent to lab.
Okay,
Okay? And then after that, we'll do the cap change, and then I'll flush with the heparin. So, first thing you want to do is untape it here. Okay, we'll dispose of that. ready. I'm gonna go ahead and cleanse the area first, your port here that we're gonna be using. And I'm gonna scrub that for at least 15 seconds and make sure we get all the germs off.
Okay.
Okay, once that's done, we got our pre-flushed normal saline here. We'll go ahead and put that on. I'm going to unclamp, and then I'm going to just use positive pressure. Make sure you're patent here, meaning you're working. So everything looks good.
Awesome. That's what I like to hear.
Clamp, take that off, dispose of that into the sharps. Now I'm going to take, well, let's cleanse that first. I want to make sure it's very clean. We're going to take 5 cc's of your blood. Make sure you unclamp. Got 5 cc's, 5 mils. And we're going to discard this one. We don't need that one.
Okay.
This next 5 cc's is the one that we are going to send to lab for lab work.
Sounds good.
Okay, so go ahead and put that, unclamp, take out 5 cc's here. And so this next 5 cc's, Mrs. Jones, can you tell me where it's going and for what?
Let's go into the lab to get some tests done.
Okay, make sure we clamp. Okay, so I'm going to go ahead and just transfer this so we can get it sent down to lab into a vacuum container here. And there it goes. I'm just going to give it a little push here. Normally wouldn't do that so we don't break the cells. But for video purposes, I'm just going to help it here. Okay. Oh, we would kept that needle and discarded it.
Okay.
And I'm going to make sure I put your name, my initials, the date, and the time, and I'm going to send that to lab immediately so we can get your test results back, okay?
Okay.
So that part of it is done. Now, I'm going to do the cap change. And so, I have a new cap here with my pre-flushed normal saline, and then I'm going to follow that with some heparin just to make sure we don't have any blood clots.
Sounds good.
Okay, so let's clean your line first since I dropped it. We want to make sure it's clean. Okay, I'll go ahead and take this cap off. And I'm just going to go ahead and clean any extra blood that, you know, may have been left behind here.
Okay.
Okay, got my pre-flushed with the cap. I've got a new cap here. Gonna unclamp, and once again, use it in positive pressure. So far, it's looking good. Clamp, dispose of that into the sharps. Then I'm gonna do heparin. Well, there we go. Let's clean that off real quick. It's got stuck onto the syringe for some reason, but we're going to clean it off before we do the heparin. So the heparin, can you tell me what that's again?
It's a blood thinner so that we don't get any clots.
Good job. Okay, so I got 5 mils here. We're just going to go ahead and flush, unclamp, positive pressure, clamp, and we're done with that. Okay, and just so your line's not dangling here, I'm going to go ahead and re-tape it up to the top here. And we are done with that, Mrs. Jones. How are you feeling?
I feel good, thanks.
Do you have any pain or any discomfort around your site here?
No, I don't, thank you.
Okay, so we are done. I'm going to go ahead and clean up my area. I'm going to make sure I document the whole procedure from the dressing change to pulling up the blood for lab work, your cap change, and just make sure everything's dated and timed, and we'll get that that's done.
Okay.
Go ahead and discard my stuff. And thank you, Mrs. Jones. Here's your call light. If you have any questions or concerns, or if you feel any pain coming on, just give me a call and I will come and help you, all right?
Okay.
Thank you.
Thank you.